We've been told that how we look and how our face's structure looks like is due to genetics. But is it truly only genetics? Did you know that your posture, whether you are a nose or mouth breather, and whether you keep your lips sealed or not at rest, have a huge effect on how your face structure looks like? When we look at a nose breather versus a mouth breather, we notice a well-balanced face compared to a flawed face shape. And mouth breathing isn't just about face shape and posture. In fact, it can result in many complications concerning health and respiration. People who breathe through their mouth and not their nose are more likely to develop sleep disorders. Children who are mouth breathers are more likely to have dental problems, such as malocclusion and facial differences. They can also develop obstructive sleep apnea. Many studies have shown that mouth breathing can change facial and oral development. When nasal breathing is blocked, untreated mouth breathing leads to the development of long, narrow faces with crooked teeth, a receded jaw, and can also cause TMD, aka temporomandibular joint dysfunction, and headache issues. When the jaw and airway do not fully develop, the airway can become easily obstructed during sleep. During the complete muscle relaxation of deep stage sleep, the muscles around the airway also relax and collapse. The airway is a tight space, often made tighter by larger tonsils and adenoids in both children and infants. And this is also seen in adults. If the airway becomes obstructed, the brain must bounce out of deep sleep and into a lighter stage of sleep in order to grind and clench to push the jaw forward to breathe again. Grinding and clenching are the body's way of reopening a collapsed airway during sleep to start breathing again. This is why grinding and clenching are the new red flag. A mouth-breathing face is easily recognized due to its poor face and posture balance. There are a few pronounced features of a mouth-breathing face, including a narrow and long face, a set back jawline, cheekbones are poorly defined, head posture is moved forward, a receding chin, an open mouth, and sometimes a crooked nose. While a nose breather's face shows lips gently sealed, facial symmetry, nasal breathing, and tongue on the roof of the mouth. And this one is quite important, which we're going to talk about next. The problem of mouth breathing should be eliminated at the youngest stage to avoid a mouth breather face in the future. However, treating mouth breathing in adults is also very effective and more controlled due to the level of commitment. If you stand straight and keep your mouth shut and have your tongue right up, fully engaged on the roof of the mouth, particularly the posterior third, you'll engage your whole mid-face to come up and forward. Also, if you have strong muscle tone from hard chewing, that will also support the mid-face. And these two things are simply the most important for a better and more defined jawline and strong facial structure. And this is known as mewing and tongue posture face sculpting. So remember, mewing is basically the placement of the tongue on the roof of the mouth. And this is the correct posture and where your tongue should rest at. This will not only improve your facial appearance and get a more defined jawline, but will also help with correct breathing, sleep apnea, swallowing problems, and orthodontic and overall facial structure. This will also help get rid of a double chin and face fat that is unrelated to weight. So how is it that the tongue is such a big factor on how our face looks like? Well, the tongue is a relatively big muscle and can exert plenty of force on the maxilla. So how can we get a better functioning, better looking face? First, make sure your posture is right. Lightly press the tongue against the roof of your mouth or the palate with the lips sealed and the teeth in light contact. And the recommended time is 4 to 8 hours a day. In fact, this is the correct way where your tongue should rest at. And any orthodontist will tell you this. Your tongue should not rest between your teeth. And it can also help with sleep apnea, breathing problems, swallowing problems, and speech disorders. So again, we go back to the importance of nose breathing instead of mouth breathing. This technique can also help get rid of a double chin and face fat. Double chin can happen due to being overweight. However, what if you're not overweight? This is due to a lack of muscles used in the neck area from bad posture, which leads to poor blood flow. And that's not all. Also, blockage of lymph nodes, which creates edema underneath the chin, leading to the unwanted double chin. Again, there are a wide number of studies that have seen significant changes in the labiomental and temporomandibular areas, concluding that this technique may enhance facial appearance non-surgically. And you probably noticed the word may on the study. This is because this cannot include everyone. The more complicated cases may need surgery. As you can imagine, it's quite hard to have a one-size-fits-all. Don't expect a radical change and set unrealistic expectations that are only achieved through surgery or orthodontic treatment. Seek improvement rather than a total new face structure.